Hello everybody, Assalamu alaikum. I am Asad Sultan Khan and you're watching The Health Show, the episode 13th. Why I'm super excited and super pumped tonight, it's because I'm gonna be joined in by Professor Shafi Ahmed. I'm super excited because he's just a massive inspiration. And he's just about to join in. So we were having a little bit of difficulties on Facebook, and that's why we've actually, made Instagram live. And he's just about to join in.
I am.
Hi, this is perfect, I feel like.
This is better, right? Okay, Facebook was a problem this morning, but it's good.
This is perfect. Let's do you want to do it again, or let's keep it continuing?
Let's carry on. I'm happy to carry on. Just make sure the good views there. Yep.
All right. Before I ask you the fundamental question about who you are, I would just like to give a very brief introduction about you. To everyone who's going to join in, Professor Shafi Ahmed was born on 26 January 1969 in the Sindh district of East Pakistan before he moved on to the UK. He's a massive inspiration. Professor Shafi Ahmed is a consultant surgeon, a colorectal surgeon to be specific, at the NHS Barts Medical Trust. Besides that, he's the associate editor of Royal College of Surgeons of England. He's the faculty member of Harvard Medical School. Besides that, he's the chairman of Health Summit. And he is just a massive inspiration. I'm completely in awe. I'm honored and grateful to have him on board here. I'm already so excited. I'm already sweating a little bit. It's just about my excitement. Thank you so much for joining in, Professor Shafi Ahmed. And with that, I would like to ask you the first question, and that is, who is Professor Shafi Ahmed? Tell us about yourself. Tell us about your professional career and the medical experiences you've been through.
So there's quite a lot to take through, but I'm trying to be as brief as possible. So look, I'm a surgeon by background. I'm a consultant colorectal surgeon, which means I deal with disorders of the GI tract. My main interest is actually cancer, colorectal cancer, and that's what I've been doing for the last 27 years. I work at the Royal London Hospital as a professor of surgery there. I have an academic role. So part in my role is academic and part of it is clinical. I also was an associate dean at our medical school, which is Barts Medical School. I was an associate dean there for 10 years, running the undergraduate curriculum and also for the surgical discipline within the curriculum. I've also been a member of council of the Royal College of Surgeons of England. I do a lot of international work, global health work. So I travel extensively around the world, working with governments, colleges, universities, institutions to promote education training to make it more accessible. Also, in my other interest is innovation, technology. So I've kind of veered away, not away, but in kind of parallel to become an entrepreneur innovator. So I work with many technologies now, and I give a lot of talks around the world. I've given over 250 keynote talks around the world in 30 countries, really talk about the future of healthcare, etc. I work with Abu Dhabi government as an advisor for health innovation and transformation and digital work. And I also am the ambassador for our big telecoms company called Vodafone. I help them with the connected health pathway. And I work as ambassador for the UK for that company. I advise many companies in tech around the world, including artificial intelligence, blockchain, whether it's kind of virtual reality, augmented reality, all of those things. I actually run my own virtual reality company called Medical Realities, who've been pushing out virtual training for medical students and postgraduate surgical trainees. So I have quite a diverse portfolio. And my last interest, of course, I do humanitarian work. I work in conflict zones to help train surgeons and to promote healthcare. So quite a lot that I do.
All right, that is just a lot to take in. And before I dive deep down into the specifics of everything Harvard Med School, NHS, colorectal surgery, and just transforming the healthcare globally around the world and working with governments and being an advisor to all the governments. Before I dive deep down, tell us about this. How do you balance everything? How do you keep track of everything? How are you a part of so many things?
Well, I guess the way that human beings work is that we need passion, we need to diversify. And I guess over the course of your career, remember, I've been a doctor now for 27 years in London. And actually, you need to harness your energy, look for different areas of interest, diversify your portfolio, and continue with passion in different areas. And ultimately, it's about having impact. What are the things that interest you? How does life change? How does society change? How do you change as an individual? And you end up seeing more interesting ideas. In the last 5 years, we've seen this kind of really amazing time in medicine where you've got so many technologies in clinical practice coming together. And this is really what I call an inflection point of humanity. It's changing. With exponential change, exponential technologies, it's really exciting. And for us, who's been around for such a long time, it's a great way of reimagining healthcare, reimagining education, how we make it work, for example, right? And so that's kind of where I am with this. And that's kind of what I've been promoting for a while. How you balance it? Well, actually, you kind of, as you become more successful, of course, you end up doing more projects. And then you've got to sit back and say, what's the important things to you? You diversify, you move, you change accordingly to see where that impact lies. So I've transitioned. Yeah, I've transformed my own career into different areas now. And I'm very happy, very excited. It's a new challenge for me in certain areas. And I'm learning more about myself at the same time, etc.
That is beautiful. Can you also tell us about what feats have you achieved working in the AI industry with the healthcare? How does artificial intelligence has been touching? How have you been able to work massively?
So it's not just about AI. AI is just one technology. So people just get hung up by one. It's all of them together. If you look at where we are now, we have a convergence of technologies. The convergence means that we have things like AI, deep machine learning, robotics, virtual reality, augmented reality, mixed reality, nanobiotechnology, genomics, blockchain. We're seeing big data science, wearable sensors. Actually, there's a plethora of technologies. The question really is how do they work together? Yeah, not in isolation. How do they continue to impact healthcare going forward? So I've worked in AI a little bit. I'm part of a company called Imera.ai, and we essentially look at images, X-rays, and particularly of the hip and the pelvis and the lower limb, from a musculoskeletal perspective, try and diagnosing problems using AI deep machine learning. So we've had that company now for a while. I've become a non-exec director and advisor to the company, pushing and promoting how AI might transform radiology services. So that's my interest in AI. But obviously, AI is also more widely accepted in all branches of medicine. And in my own specialty of surgery, it's now becoming an important discussion. We haven't quite introduced AI into surgery. It won't be long. In the next 2 to 5 years, we'll see lots of interest there.
Wow. All right. So tell us about this. How did you, started your medical career? Where did you graduate from which college? How did you moved on to university? And how did you actually, began to join and be a part of so many diverse things, right?
Yeah. So look, as you've said right at the beginning of the show, I came to the UK when I was 4 years of age, back in '73, from Bangladesh. So I've been educated in the UK entirely. I've went to medical school at King's College Medical School in London. That was between 1988 and 1993 when I qualified. Became a junior doctor, an intern, or a house officer, or an FY1 they're called these days. And I worked in London. And then I did all my surgical training at the FRCS, etc., all in London, all my surgical training, around East London, in fact. Then I did my PhD during my training in cancer genetics, based in London. I spent a couple of weeks at Princeton University in the US, and this is all around cancer genetics and bowel cancer, and looking at prognostic factors, things that will trying to figure out the risks of people dying from the disease, etc. And then I came back and became consultant in 1997 at the Royal London Hospital, so 2007, the Royal London Hospital. And I've been ever since. I took a role at medical school and many roles at national levels. So I've been a consultant now for 13 years, I guess. And now, in that time, I've transitioned. Surgery is always about technology, always about innovation. You always think about the next best solution. We went from open surgery to minimally invasive surgery back in about '92. I remember when I was finishing medical school, suddenly laparoscopic surgery came in. It was a new concept. I remember the first gallbladder being done then, which was really interesting. And from then, of course, I've driven minimally invasive surgery. And I was appointed to the Royal London to promote and bring in minimal access surgery. So I've been practicing that for the last 15, 20 years now. And so now, so that's why I've been for the last 13 years a consultant. But in that time, of course, I was working with many companies, bringing new equipment in, designing new ideas with Johnson & Johnson and Medtronic, working with their engineers, etc. Always think about new ways of working. Now that I introduced something called single incision laparoscopic surgery, SILS, which is a single port surgery compared to multi-port spur keyhole surgery back in about 2012. And I promoted that work really hard to push and drive even more remote surgery. And then as I was doing that, then all the technology came in on Google Glass back in 2014, virtual reality. I decided that's where I wanted to be, to teach people, train people using different modalities to improve surgical access around the world. And I guess being a surgeon, you always have that interest and passion around innovation and technology. And I just found I was at the right place at the right time, as society had moved on to where this was going to be much more beneficial. So I'd say it's been an interesting journey for the last 5-6 years. If you'd asked me 10, 20 years ago, would I see myself in this position? Of course not. I was going to be a jobbing surgeon working my whole career. But now I've transitioned, I have had the opportunities. And a lot of doctors now are seeing the opportunities outside medicine, or even in parallel. They're creating portfolio careers. They're working with different organizations. They're having startups of their own. We're seeing great kind of interest in entrepreneurship and innovation across young doctors. I think we need to kind of acknowledge that, support them in their ambitions, and create a new way of working. And that's one of the things I've been pushing and driving hard, is how we create the doctor of tomorrow. Because at the moment, we're not really fit for purpose. And I think human beings are changing. Doctors need more now, different ways of working, flexible working. They want to be part of innovation. They want to be able to use technology. So I think the digital skills required have been changing enormously. We need to embrace those, of course.
That is absolutely inspirational, Professor Shafi Ahmed. I mean, it's awe-inspiring, the kind of journey you've had been, and the amount of years of the body of work that you've put in into surgery, into technology, into helping the other people, into entrepreneurship, especially the Health Summit and everything else. It's just a great body of work. But I'm also interested in NHS, right? What do you think about NHS? How has been your experience with NHS surgery? Because there's a lot of people who want to join the NHS, but they also see America and the US as a better prospect, as a better competent model of medicine and healthcare. What do you think about NHS, and what do you think about its future?
So the NHS is one of the best healthcare systems in the world, there's no question. So we promote quality and we promote fairness, i.e. it's free for everybody who wants a really good service. So it's one of the jewels in the crown of the UK, there's no question, right? When it came out in 1948 as inception, it said that we should be having free access to healthcare at the point of access. Everybody who's anybody, doesn't matter whether you're rich or poor, to access the same fair healthcare treatment. And that's been the kind of the background, the backbone of the NHS. And if you look at all the metrics around the world, across every metric, it comes almost top in every metric. So that's still good to this day. We've always been offering good training for many, many years. I think people come to the UK from India, from Pakistan, from Bangladesh, and all around the world because they hear about the training that we've provided for so long and the quality of care. And the other thing that the NHS does is really put patients at the centre. It's very patient-centric. It's about how you behave, and the work in the NHS teaches about how you manage people, how you manage a service, rather than just being a pure technician. It's how do you evolve your whole practice. It teaches people on ethics. It teaches people on management skills, research, education. It's kind of an umbrella of all of those things. It still does it well. A few years ago, of course, they had a few problems in terms of promoting people from overseas. The international medical graduate found it hard. They changed the visa rules. It became tricky to get a tier 2 or tier 5 visa. And that stifled some of the relationships we had abroad. We still need people to come. We still need good people to come here. It's a great place to come and train. There are opportunities, and hopefully you will do well. And I actually ran something called the International Surgical Training Program for about 4 years, where I actually traveled widely across the world, visiting almost 30 countries, and I collaborated with about 45 overseas institutions to target training in other countries where services weren't perhaps as good. And so we brought them over for 2-year training targeted, and then we sent them back with those skills to those areas. We worked with governments to identify. So I interviewed, for example, in Egypt a few times with a medical military Academy and the government there. In Sri Lanka, with the College of Surgeons. In India, I went to Mumbai, and also in Hyderabad, as well as Kolkata. In Bangladesh, in Dhaka, Qatar, Bahrain, Dubai, and the African countries. And we're trying to bring people over who would benefit from training. So, for example, we had a surgeon from Malawi whose government said we really need some urology training. Urology, basic urology, not robotic urology, basic urology. Because he was the only surgeon for something like 100,000 people. So we brought him over for 2 years, trained him, and now he's back supporting his services. So there is that whole aspect the NHS can offer, as well as training here, good career pathways, trajectory. It's also creating experts to deliver healthcare around the world. So I think it's still open. I think I'd encourage them to come here still. We need good people. And obviously there's a system to get through the barriers with PLAB and perhaps the exams, etc., to get through it. But otherwise, it's a great opportunity for people. And I think we look after them very well.
Wow, that is absolutely beautiful. And that makes me come to my next question, which is obviously everybody listening to you right now is also thinking about this. And that is, Professor Shafi Ahmed, what is your inspiration?
It changes, of course. As you get older, it changes. When you first trained, your inspiration was to be the best doctor you could be, then the best surgeon you could be, then the best teacher you could be. You've always been inspired by people around you. I'm inspired by people around me. What I'm inspired by now is the global community. I'm very much into how can I impact globally, whether I teach through Google Glass or virtual reality, push educational platforms, or work with people in various parts of the world. I'm inspired by the goodwill of people who want to help and support one another. So I'm inspired by our global community, which has now come together more during the pandemic over the last 3 or 4 months, which I think has been a great opportunity for us. Although the pandemic has been a horrible, nasty thing to experience, the positive is that we became more of a global community much faster. We're also seeing innovation being implemented much faster, with less regulations, more translation into clinical practice, and a lot more interest in the whole of digital transformation. So, and that's what inspires me. I mean, it's now I'm thinking, okay, what legacy do I need to leave behind? How can I promote healthcare around the world, make it more fair, and more accessible, and more affordable? I highlight my experience in Gaza. So I've been going to Gaza for 5 years, working with the government and Ministry of Health, and also a NGO called Medical Aid for Palestinians. And I go there in a conflict zone of 5 years, trying to create training, trying to promote standards, etc. And that inspires me, seeing how people around the world, under the most difficult circumstances, are still striving to be the very best and train themselves, etc. So I'm inspired by fellow colleagues. I'm inspired by people who want to promote good work and promote the well-being of people globally. So that's kind of my inspiration now, as well as my 2 young children, of course, who are now approaching university life in the next 2 or 3 years. And they'll be my inspiration, of course, to see how they progress. They both want to do medicine at the moment. We'll see how that goes. Very keen on pursuing a medical career like their mother and father.
MashaAllah, this is absolutely amazing. Please tell us about this. Since you're in the health show, we're all very curious to know about this. How do you keep yourself healthy, and how can people listening to you right now keep themselves healthy?
Yeah, so there's two. One is mental health and well-being, and one is physical health. The two are combined. And I think it's important to ensure that you're always inspired, you have a goal, you think about your life in general, about your own impact, people around you, make sure that you're a kind of good person, you deal with things, and that you're happy in what you do, of course. And that's always important for your own well-being, to ensure that you're surrounded by friends, family, people who support you, and you have your own ambitions. The physical side, of course, is another important one. We kind of, as doctors, we often let ourselves go a little bit, because obviously we're very busy working 100 hours a week and excess hours. And actually, you're going to take time out for yourself. Remember, resilience is important. You also have to look after yourself and your own health, in a sense. Regular exercise, taking time out. And I know what I do. I cycle a lot now because of the pandemic, because of the lack of contact. Taking a bike, I cycle everywhere, and it's been a revelation. You can just do simple things to make yourself fitter. Whether you do sports or go to the gym, whatever it is. I think a regular amount of work makes sense. The other thing I think the last few months have shown us that we've all been eating too much because we've been stuck indoors. Everyone's put weight on, we're eating too much. And actually, as this winds out, we should all be much more proactive. What the pandemic has shown us also is the quality of life, because most of us have been at home now, spending time with our family and loved ones, which we haven't done before for such a long time. And it's showing us the value of human contact, value of people around you, your family, your loved ones. And I think going forward, people will now make choices about flexible work, about being happy, having a much better work-life balance. So I think all those things now are so important to address. I think this pandemic's actually given us the opportunity to address some of those fundamental issues about how society works. And that's what I would say to you. Keep yourself healthy, your mind productive, work hard, of course, in both lives, but also have time to yourself where you can get away and actually review your own life and your own objectives, etc. And enjoy. I think it's about enjoyment, doesn't it? We kind of work so hard, Assad, all our lives. We get caught up in the work, in terms of financial return, try to maintain life, etc. But we don't get a chance to enjoy ourselves as much. And maybe we should now think about the balance between what you need financially, what you need to do in terms of promoting yourself, well-being, as well as being happy and actually being someone who's going to be a joy to be around. So I think all of those things are very important now.
Wow, thank you. That has been very insightful. Now I have a very burning question inside of me, and I just want to ask you about that. And that is, if somebody wants to achieve the heights that you have achieved during your career, if somebody wants to be a surgeon, let's say in the UK, if somebody wants to be a member or at a high-profile rank in the Harvard Medical School, if somebody wants to create an impact in the NHS, in the Royal College of Surgeons, being an entrepreneur, changing the healthcare globally, if somebody has the goals that you have and wants to achieve what you have in times 10, he wants to do it times 10, what you just did, what advice do you have for him or her?
It's a really great question. So firstly, look, I'm not exceptional. Yeah, I'm no better than anybody else. Alhamdulillah, I've been fortunate with the will of God, of course, but also some hard work has gone down the line. It is about hard work. It's about application. It's about drive, ambition. And if you've got the skills and you work hard, undoubtedly you'll be successful. There's no question about that. If I can do it from my background, with all the barriers I face, there's no reason other people can't do it themselves. If you look at my Facebook or my Twitter profile, you'll see a picture of me and a quote. And the quote is quite simple. It says that we're only limited by our own sense of wonder and our own imagination. That's all that limits us. So if you can break those barriers and have a wonderful sense of wonder about where you're going to be, where you'd like to be, and you can imagine the world is there to be reimagined, then you can be one of the change makers. And all of us should think about, how am I going to be a change maker? How am I going to be that difference to the world? What do I put into myself? What's that bigger picture look like? I think it really is for everybody in society, in the world, to make this a better place for the world, right? And you all have a role in that. And success will come as you work hard, as you achieve, you'll get the success that you deserve, and you'll get more success. It becomes a roller coaster. Be a good person, be a nice person to people, work hard, of course, look after your fellow people, your friends, your colleagues, people around you, but also think about being a leader and a visionary. All those things will come over the course of time. It won't come immediately, it takes time, right? You can't expect to run before you can walk. Learning skills. As a doctor, I'd say first and foremost, be a really good doctor. Get your skills. You want to be the best doctor you want to be for people around you, your patients, yeah? Learn all your skills. Use that as a springboard, as a catapult to do other things. And also, don't be afraid of challenging. Be the person who's going to challenge what's going on. Be what I call the exponential thinker. So one of the things I say to people about who's going to change the world is go from being a linear thinker to an exponential thinker. I'll tell you what I mean by that. If you think in linear steps, incremental steps, which is how society works in so many ways. So if I said to you, Assad, let's take 30 linear steps together. If we walk together, we'd get to about 30 yards. You know how much that distance is. It's obvious, right? If I said to you now, Assad, let's go on 30 exponential steps together, how far do you think we'd get?
That is unimaginably long.
I'll tell you, we've gone around the planet 26 times. And that's the pace of change that you've got to get into your mind. This is where life is heading. This is where society is heading. This is where technology is driving this innovation. Be that person who's an exponential thinker, who's really thinking ahead, and also put innovation at the heart of your existence. You want to change. You want to constantly demand change. What's better for my patients, myself, and keep doing that. Because ultimately, that's what's going to drive your ambition. And don't be scared of failure. It's okay. We all fail at some point. It's okay. Pick yourself. You go again. No one has an easy ride. No one has everything smooth. We've all been through barriers, difficulties. We've failed at certain things. But then pick yourself up and then move faster and carry on. So I'd say all those things would make successful, if that makes sense.
Thank you. Thank you so much. That has been very insightful. My next question is about surgery, and particularly all over the world, because in the context of COVID-19 and the pandemic, we've seen that a lot of surgeons and physicians, they've locked themselves inside the home. Obviously, there wasn't that business wasn't going on. Only I feel like the pediatric physicians, the acute emergency, the GPs, and the gynecologists, only they were something working out there during this time, during this crisis when it was at the peak. So what do you think about the future? Obviously, everything after COVID-19, everything is changing. It's a whole shift going on. A majority of the things are going on telepathic, on virtually. Virtual reality is becoming the reality right now. AI has been a part. So with the whole crisis going on, what do you think about the future of surgery in the UK and all over the world?
So if you look at surgeries, let's talk about healthcare as a whole. So the last 3 months, what it's done, it's compressed time. So the innovation and technology that would come in 2 to 5 years can squeeze into about 3 months. We've accelerated so much in the last 3 months. So this is what we call the new normal. We're not going to go back to the old normal. We've moved on. So that's the first thing to say. We're starting at a different place. And society can't afford to go back. That's the first thing. So healthcare will change immeasurably. Imagine my clinics now. So what I do in my clinics now, it's all virtual. And most around the world are virtual clinics. So I have my laptop at home with the electronic health record of the patient, with a smart card, which I can access the information, and it's secure. I then go to my telemedicine platform, my iPad. I connect with my patient in the waiting room, virtual room. I see them, I consent them, and look after them, and then book them for an operation they need to. All done remotely anywhere in the world. Don't have to go face to face. I then use my Beam system, which is like a mobile iPad on wheels, which I can walk around the wards. If I'm from here, I can see my patients, be remote. So the word remoteness virtual is now coming in. So that's the kind of concept that we're driving. Surgery is fascinating. We're going to see huge change in surgery because technology is driving surgery. Robots have been around for 20 years. The Da Vinci from Intuitive Surgical have been around for 20 years, and they were really the only ones in the market. 2020 sees an explosion of other robots. We have Cambridge Medical Robotics. We have Medtronic. We have Johnson & Johnson working with Google with the Verb robot and many others. So suddenly robots will become more cheap and more affordable. So many more people will have robotic surgery in the future, undoubtedly, because it becomes more affordable. We're also seeing things like AI and VR and AR coming into the world of surgery. So you're seeing overlays of information, wearing headsets like Magic Leap or HoloLens. You can overlay information onto the patient to pre-plan surgery or even help during the operation with real CT and MRIs going on there, for example. So that's going to be really interesting. And the other one is going to be around, I guess, the fact that you can use AI analytics. You can probably judge people's performance better because you have more data points. So we're going to data-driven healthcare where data becomes the kind of new oil of the economy, right? This is the new concept. Data becomes so powerful. And then we can really, probably much more in a sophisticated manner, work out outcomes better rather than the crude stuff we have at the moment, which is based on mortality and morbidity. So the world of surgery is becoming digital. New terminology is digital surgery. It's a new concept. So we're working on to a world where digital is coming in for teaching, for learning, also for training, but also for clinical practice. So I think surgery is one discipline that will change immeasurably over the next 5 years, and it's really exciting.
Wow. This makes me exciting as well because, seeing surgery changing into a totally, virtual reality landscape is fascinating. I feel like, and that is something that we cannot, move aside from, right? It's going to happen. It's the new norm, just like you said. Tell us about this. What's the future of NHS in the coming 10 to 20 years? Because we've seen a lot of people in the UK, and there's this news always going on, which is a lot of doctors who are graduating from UK, they're leaving UK because, they think NHS is not, NHS is very patient-centric and not as much as doctor-centric as the Australia and the US. What do you think about that? And what do you think about NHS, going downhill or uphill in the next coming 20, 30 years?
It's a really good question. I think all healthcare systems are challenged at the moment because the cost of healthcare is rising. So if you look at America, for example, they're putting over almost 20% of their GDP into healthcare. It's more expensive. The UK puts about 8% into the GDP, okay, so much less. So that's the first thing. And the other thing is the healthcare cost is rising. People are getting older with more chronic diseases, and expenditure is going up. There's no question. Every country is spending more and more on healthcare. So what we have to do in every healthcare system is be more smart. So how does that same money go further? How do we redesign healthcare? Maybe even push more healthcare to the community, make sure the less patients go to hospital where it's more expensive, and also spend more money on prevention and well-being and wellness rather than treating the sick when it's too late almost, right? So we've got to rearrange our thought process around what health and care actually means. And just here long term, it's not going to change. It still offers really good clinical practice, good training, and good, I think, treatment for our patients. There's no question. I think people make those choices. America is very attractive for many reasons in terms of remuneration, short training in that sense, which is quite hard, but it's shorter. And then you can do very well in terms of your clinical work, and you can be research, academic, and it's got great institutions. No question. Australia similarly is about the NHS. It's more similar. But again, I think the doctors are probably more valued in Australia at the moment compared to the UK. And I think we've been through a sign where we're not as... NHS has changed slightly because it's become more multidisciplinary, whereas before it was very hierarchical. Doctors were very much the gods of medicine, right? You had complete control and you were the change makers and rule makers. And other countries still have that old-fashioned way of thinking. We've moved to more about team and collaborative working. You're one part of a greater team. The nurses, the occupational health team, the managers, and you become more embedded into a system where it's more about team approach of working. There are some people who don't like that. They haven't ready for that change. I think it's the best way. I think we'll get away from this vertical hierarchical method of clinical work. And I think it's more about accountability and making sure that you're being fair to our patients. Have we gone too far the other way? Possibly, where doctors have lost some of their respect and perhaps some of their power, I guess, in the sense that they don't actually drive as much change as they used to. And that's the balance, I think. But I think all the healthcare systems around the world offer different things. You've got to ask yourself, where would you like to be? What is the healthcare system you want to be in to work as a healthcare clinician?
Wow. All right. But, a kind of question that I always hear from people, especially from people who want to go from India, Pakistan, Bangladesh, all these countries, they're always concerned about this because they feel like US, is somehow in the news. It's like the most competent healthcare model in the world right now. And so just like you said, people are being more valued in Australia as well. What do you think is the core reason? And do you think it's going to change in the next coming year or is it going to remain the same?
I think it won't change too much. I don't think we're going to go back to the old days. I expect the other countries will come to our line of thinking over the course of time. It's more likely they'll change their systems than us changing, going back to what we were like before. Yeah, we're down a road now. We're down this journey, and we're okay with that. So I suspect that other countries have to adapt and change because we can't carry on as we are. Remember, I said before, healthcare costs are unaffordable. It's too expensive. Let's take an example. If you imagine having cardiac operation in America, the cost for a private insurance-funded cardiac bypass is well over $200,000, dollars. Okay, $200,000 minimum. In India, if you go to the Narayan Institute run by Shetty in Bangalore, it will cost you $1,500. Okay, in the UK, it's something like $30,000 to $50,000. So you can see where the healthcare is changing. Yeah, it's where it's affordable, and it's got to change. We can't carry on spending the entire sum of money onto healthcare to make it more affordable. So although America is great in that sense, it has amazing doctors and healthcare workers, amazing research and amazing institutions, their model also it doesn't work either. It's too expensive. Yeah, and we've seen the issues around the Medicare that's been described by Obama and others, where now a significant portion of Americans simply cannot have healthcare treatment. Okay? So, for example, a diabetic. In the UK, if you're diabetic, all your treatment is free. Whether it's insulin, whether it's oral hypoglycemic, it's all free. Okay? Because you paid your taxes and part of the system. In America, an injection vial, just one injection of the insulin, you might need 3 a day, can cost you over $100. Okay? So there's no way you can afford that. The price is just too expensive. So you ask yourself, what's fair here? Do you drive the American system, which is great, there's no question about that. Sometimes it's too expensive. A lot of people get left out because they can't afford healthcare. Are you happy in that environment, not to offer care to people who can't afford it? Or if it comes from here where it's more fair and affordable, there's some barriers in place also. And that's a balanced argument for anybody who's deciding on whether they want to go to work. And that depends on your own interests and passions and the desires that you have going forward.
I feel like you just laid it out very beautifully. I feel like you just laid it out very thoughtfully and very thoroughly. I feel like anybody who's listening to this right now and wants to make a decision, I think it's much clearer now. My next question is the most interesting and the most exciting question of this show. And that is, if you had the time, energy, and money to do anything in this world to keep you healthy, what would you do?
So say that again, to make you healthy, to keep you healthy. Sorry? What was the question?
So just to keep you healthy. So you have the time, you have all the energy, you have all the money, all the time in this world, and you can do anything. What would you do to keep yourself healthy?
Well, you know what? I think I'd travel. I travel a lot anyway. I'll do even more traveling. I'd get the chance to see wonderful countries. I'd get to see different civilizations, different communities, different cultures, learn more about the world we live in, and then see how I can help and impact them with my experience, my knowledge, both skills as a surgeon, as a doctor, and also as a humanitarian. I'd like to see how I can help support them. As I travel, it's going to be some exercise, it's going to be good for your health, both mentally and physically. So I think I'll do even more traveling. I've already been to about 40 countries over my lifetime, working in different avenues, different parts of the world. And I'd like to do more exploring. There's parts that I'd love to see. So I think if I had all the time and money in the world, I would just go and travel around the world, impacting people, impacting societies, and see what I can do to make a change. And I've been entirely comfortable with that. And I think it'd be quite rewarding, as well as being, I guess, inspirational for me as well, to see how the world works. Because we are a global community at the end of the day. And we sometimes get lost in that in our own kind of very insular fashion, because that's kind of what we do. We've got to think outside the box, think more global. And as John Scully from Apple, CEO, used to say, zoom out, see where the problems are lying and how you can evoke some change. So I think that's what I would do, personally.
Wow, that is absolutely beautiful. And there was this question that sort of popped up into my mind while we were having the conversation, and that is, doctors all around the world, no matter where you are, especially UK is very good in terms of the work-life balance. But then again, if you're a surgeon, especially a surgeon in the UK or anywhere in the world, there's long hours. There's you're there day and night. It's long working hours. It's a lot of years put in, especially in the UK. There's 3 to 4 extra years in your post-graduation. And so there's a lot of body work that you have to do. How were you able, and how can anybody make that leap, make that transition from, being a surgeon to being an entrepreneur and traveling all around? It's because you are literally one of the very rare, species in the world who have been able to travel around the world, because I've seen surgeons, I've seen doctors all around me. People just don't have time. How were you able to make that leap, and how can we make that leap at that time as well?
It's a really good question. I think it's about passion and desire. If you're passionate for something, you're willing to put hours in. It's just the nature of the beast. So working in clinical work, I had a passion for surgery. When I left medical school, I knew I wanted to be a surgeon. Yes, we were working over 100 hours a week for many years. But you put that time in because the reward is going to be that you're going to be a good surgeon. Thankfully, those have changed. That's changed. It's less hours now than before. Still busy, but less than before, which is a good thing. And then as you go on, of course, you change. Every 5 or 10 years, your own mindset changes, you shift, you think about new ideas, new areas, and now there's a world to explore, whether it's innovation, whether it's technology, or whether it's something completely different, doesn't matter. So I think you've got to make sure that you're open to other conversations. You don't very much have a tunnel vision. because then you just do one discipline. And at the end of it, you'll be frustrated by lack of progress or something else. Keep your vision wide open. What's going on out the world? Keep a bigger view. Do travel. People do travel now. It's easy to travel now. Although not now, of course, in the pandemic. But travel became really cheap and affordable. You could get a ticket for next to nothing. You can travel. And you can do short trips. A lot of my trips were very short. You traveled very quickly and you came back very quickly. Yes, not compromising your clinical work, taking time out, etc. So short, sharp trips that were reasonable, and then spending time doing that kind of stuff. So it's balancing life, your family life. I have 2 children and a wife, of course. You're balancing all those things to kind of keep pushing and driving. I think it all comes down to passion and drive and ambition. That's all it is. That's what drives change. If it's something you don't like, you won't do it.
And just to really crack this enigma right here, just like you mentioned, there's 100 hours per week, every week. How do you even find that time? How do you find those hours to spend and be an entrepreneur in the first place? Because being an entrepreneur is not an easy job. It takes a lot of capacity building. It takes a lot of leadership. It takes a lot of networking. It takes a lot of exposure and a lot of years of building your personal brand. How can somebody take those hours from 100 hours a week and surgery day and night, emergency calls and hospital shifts? How can really somebody do that?
Yeah, that's a good question. Look, I think the hours aren't as bad in some countries as they have been before. It's kind of. Look at the UK, for example, the contract now is at 40, 50 hours compared to it was 72, 100 before. So there's a bit more time. It's still not a lot of time for your full-time job. Think about taking time out, going part-time, flexible time working, thinking what do you want to leave, and how do you want to work, and making decisions about what's important to you. But the other thing, of course, as you get more senior, as you've done those hours at the beginning of your career, you become experienced. Now I have more time. I'm not training anymore. I've done what I need to. I've driven surgery for the last 27 years. Now I have more time because I'm comfortable with my experience. I don't need to prove anything else. There's no other operation I want to perform or learn. I've done all of that thing. Now I've got time to say, actually, now with my experience, is how do I use my time more effectively? So and that's different people. I've come in a different way, becoming more senior, because I thought becoming a doctor was very important for me, my aspiration, and then moving on to other areas like education and innovation. Others might actually, I want to do it much earlier. I want to have the opportunity to do it earlier. How do I find the opportunities? And what I'm seeing now is there are many more opportunities now than there were before. 20, 30 years ago, there were no opportunities. You just became a doctor, and that's all that you did. You carried on working and less hours. Now I'm seeing a much more work-life balance, people deciding to have what's called portfolio careers, to have 2 or 3 different careers going forward and balancing them accordingly. It's never easy, but I think most people now have the ability and also the support around them to make that work, which wasn't there before. So I'd say I would encourage people. I had, for example, one of my trainees, for example, we have always had problems always trying to get training all the time because there's huge change and shift, people move on, and they keep getting some new people in. And I realized the jobs weren't suitable for new people. The jobs are old-fashioned, and young people are different in their mindset. So I advertised a job working for me. So they're working for me 3 days during the week, i.e. clinical work, operating theatre, and some emergency work. The other 2 days, it was innovation. They were called an innovation fellow. They would work on innovation, on technology, with some of my companies, innovating, spending time with AI, wherever it was, and having 2 or 3 days out every week. So they could do both in parallel. And do you know something? When I advertised that job, I had hundreds of people applying for the job all around the world, because that's what they want to do. People now saying, we want different kind of jobs to be exposed to, right? So I think we, as professionals, really think the model of the work that we do, promoting innovation. Eduardo is on the call now, because Eduardo Rangel, Eduardo, he's a great radiologist based in Mexico, also working tech innovation. You realize also it attract people now in a different way, and that's been missing. So I think there's an example. The medical school curriculum hasn't changed for a long time. It's still 5 years long, okay? It's still 5 or 6 years with basic science and clinical sciences. And so 5 years ago, I introduced something called the BART X program. It was revolutionary. We put in a program for all of our year 3 medical students based around innovation, technology, entrepreneurship. So all of our medical students were trained by people from Harvard, Singularity University, from Stanford, from the UK. They were designing ideas. They were getting together to have a hackathon, create business ideas, and then go to a pitch for their ideas. teaching them different ways about working. So this is the way we redesign our undergrad education system, our postgrad system, and our surgical jobs, or our medical jobs. It's different now. We're in a different place. So I hope that inspires a lot of people to rethink about the way they're training their junior doctors, thinking more widely, also more relevant to the world that we live in.
That is just awe-inspiring.
Salvatore, hi Salvatore, join us from Italy. So I've got my friends from Mexico, from Salvatore is a great surgeon from Italy in Milan. Hi Salvatore, does a lot of training on Instagram. You should follow him.
Oh, that is absolutely brilliant. There was this one question that I got into my DMs, and that was, for junior doctors going from outside UK, the IMGs, and they want to pursue surgery. It's getting really really hard because every single year it's getting harder and harder because there's like more applications and less seats, right? And so, how can somebody who's an IMG who doesn't belong from the UK, who's not a national, how can he really work hard, and what kind of, specifically, what can he do to make sure that he gets a, seat, a place, a job in surgery and pursue his career in surgery? Because it's getting hard, right?
It depends on what level they are and what they want to aspire. There's one thing is about getting experience in the UK and then going back. That's one experience. Another one is to come here and have the aspiration to have a career in the UK. Yes, so there's two different models here. And look, say for surgery, if you look at the program, it is competitive still. It is pretty tough, there's no question. I think we're now going back to getting more IMGs in because we need them, because there's a lack of people in, there's gaps in the rota, we need to support the services. So there's been a change recently about more people being allowed in. And with Brexit now happening, I expect we'll have more people from overseas come back in again and relook at where we are. Because what stopped the IMGs coming in was Europe. The European Union, because they have to have first priority of all jobs, and then it's pushed out widely. Right? Now that's been changed with Brexit. So although I'm not a Brexit fan, by any measure, it may improve the way that people could come into the UK in the future. I'm sure that's going to be the case. If people want to get targeted training, my program I used to run the college, the International Surgical Training Program at the Royal College of England, was designed to help people come across with one or two years training, targeted fellowships, etc. Still available. We're happy to promote and support that. If you want to get in, let me know. At younger stage, of course, you come in and do some either house jobs again or SHO jobs, etc. at the beginning, and then you work hard and you promote yourself, go through your career, and then the opportunity. I said before, always, if you're good enough and if you're hardworking enough, you will succeed. It is quite simple as that. You don't have to be Einstein, you don't have to be the world's best. We want good, hardworking doctors who are competent, who work hard, who want to be trained, who are eager, who are passionate. And you know what? You're going to survive and do well. The NHS needs people. The NHS can't survive on just the amount of people in the UK itself. We need people outside, like any country, of migration, of getting skills from around the world, of bringing them in. So I said the two important parts is do your homework, work hard, get in, and drive your ambition. We're here to support people like that. We're here to really support everyone and give everyone an equal opportunity around the world.
Thank you. Thank you so much for this. We have really less time right now because Instagram has an hour limit. So I would like to ask this, and that is a very interesting question, and that is, what would you tell your 20-year-old self?
It's a really good question. I'd say, I'd still probably say to him that, when I was 20, I wasn't quite sure where I was going to be. You had insecurity, you just entered medical school, you're not quite sure what your future's going to be. And it changed. Who would have thought I'd be here now, some 20, 30 years later, in my position? I'd say dream big, yeah? Think widely. Think about what you'd like to achieve and how you're going to get there, how you're going to work hard, how you can take every opportunity that's given to you. Because every opportunity you have is golden. Take them all. Take the opportunity to keep your eyes wide open. Develop a different kind of mindset, thinking. Think global. Think about how you're going to impact just yourself, your society, also on a global level. What is that person like to become in 20 years' time? And what is a legacy like to leave behind? And what would you like to be remembered for? What is the young Shafi Ahmed at the age of 20 going to leave behind and be remembered for? And what is that he wants for himself? And drive ambition. And find your passion. Work hard, and you'll get success. And then don't stop. Help others along the way. Drive other people up. It's not about you driving yourself up. Drive people around you together. Work in conjunction. Work as a team. Show your leadership skills. All the kind of things I've learned from is how to make a change, drive yourself, be successful, and how you promote people around you at the same time. So I think it's that collaborative effort I talk about. But basically, I'd say that be the change maker, be the inspiration for other people.
Wow, that is absolutely beautiful. And I feel like you didn't need all of this because you already became what you wanted to be, and that is just like this. That is massively inspiring to be honest. And I don't have more words to say because you're really a rare species because of surgeons and doctors all around the world because there's not many people like you who are making history right now, and that is just brilliant. And seeing how humble you are, how I'm honored to have you here, honestly. And now I'm about to ask my final question, and that is, what's that one thing you want to leave the audience with tonight?
So it goes back to what I was saying earlier. If I can leave people with the thought process of becoming an exponential thinker, that's what I can leave behind. Don't think in linear, small steps. Think bigger. Think exponential. Be that person who really understands that future we're developing. Yeah, and I said, be the change maker. I mean, think that last 3 months and the pandemic and virtual, etc. I predicted 5 years ago. So I just think differently. We actually, the future is virtual. We have to, can't carry on. We have to teach remotely. We have to use telemedicine. We have to do all these things. And thankfully, in 5 years, it's come to fruition. Actually, it's actually not thinking about everybody else. Thinking, what is that future? How do I create it, etc. So I guess the last statement is, don't be a linear thinker. Be an exponential thinker. You can make exponential change. And you make a difference.
Wow. Thank you so much. It has been a very insightful conversation. It has been a beautiful conversation. I was just like, in the start, I wanted to tell all the awards that I saw on the internet, which you have under your belt. You have such an enormous body of work under your belt that is massively inspiring. What do you think about, healthcare in Pakistan when you see, from outside, from the UK? What do you think, how it's changing? And that is something that I would like to wrap it up with.
Sure. So I came and gave a talk in Pakistan in Karachi about 3 years ago. I gave a lecture at the what's it called? The big one in Karachi. What was the name of it?
The Aga Khan University of the Dow.
University, yeah. I was there as an invited lecturer, and I gave a talk around the future of healthcare, and I got a chance to visit it. Pakistan has enormous opportunity. Pakistan, also remember, creates the most amount of doctors in the world, right? A lot of doctors, many medical schools. You've got a huge amount of people who can work in the system. I think now that you've got Imran Khan as in power, and also he's promised more innovation technology and healthcare resources, it makes sense to me. I think this pandemic allowed to think differently. You've got great clinicians in Pakistan, don't get me wrong, because amazing hospitals, really top world-class clinicians. And the idea is then to how to use that workforce in a different way. How do you make the workforce work better, more smartly? And a lot of doctors are unemployed in Pakistan because there's so many people around. So how do you use that workforce smartly? How do you ensure it gives them back to the society? And they're employed, they get good income, etc. How do you create a system of care that's better, that's more fairer? How do you take away some of the inequalities of healthcare that we all have, in Pakistan no differently, to ensure that everyone can get access to the same healthcare system, right? How do you recreate and reimagine health and care that's much fairer overall across rural parts of Pakistan to other parts of Pakistan? You know, there's women who designed their app on telemedicine platform because they're using women who are not working to use telemedicine people. So there's lots of inspiring people in Pakistan. There's real good technology, innovation. I mean, you're great for startups and innovation, there's no question. For computer science, you have to bridge that gap between with healthcare professionals, engineers, technology partners coming together to redesign your own healthcare systems. Only you can do that. We can't do that for you, to advise you, but you have the skill sets required to do all of those things. I hope the pandemic has also helped you as a nation, as doctors and healthcare workers, to really also think differently around how you're going to educate, train, and also practice clinically and put innovation at the heart of that, and perhaps with technology to help support the program. So I'm very optimistic for you. I think you've all the things you need. You've just got to get all together, work together collaboratively to make it work.
Thank you so much, Professor Shafi Ahmed. It was an absolute pleasure to have you tonight. This has one of the most insightful conversations I've ever had in my life. I was really looking forward to this session amongst many other the listeners that we have. What do you think about the health show in general?
Great for you. Well done. Love it. Well done, Sad. We need people like you to promote things. You've done a really great job. Got a great following. Sad, I've been seeing what you do. And that's what you've got to do. You've got to promote people, see what's happening around the world, bringing people, talking about different areas, and getting insights from people. And as I said before at the beginning, the global community. What you're doing with your show is bringing the global community together. And that's so important to share ideas, to share kind of thoughts, to share people's experiences. What I found in the pandemic is even more important now. The global community comes together and to provide the conversation that's going to be important for all of us. You're the kind of the part that holds it together, the covalent bond, if you like, of a molecule that holds it together, bring people in, have their conversations, and promote people from different backgrounds, different practices, and also to enhance people's expectations in Pakistan, which is what you're promoting, ultimately to help support your own system, of course. So well done.
Thank you so much. It actually means a lot. I'm still super excited for another session some other day. Because you're just that amazing. And we have a lot to learn from you as well. But thank you so much for your time. I'm super grateful to have you on board tonight.
It's my pleasure. Thanks for having me. All right.
All right. Goodbye. Allah Hafiz.
Bye.